Hey guys, this is Deanne with Hope Point Myo. I wanted to talk to you today about what myofunctional therapy looks like. It's different for different providers. I'm going to give you what it looks like on my from my perspective or how I do things at Hope Point Myo. But it's orofacial myofunctional therapy. Orofacial just stands for mouth and face. Myo means muscle, functional therapy. So it's basically physical therapy for the mouth and the oral cavity, the face, all that. And our 4 goals for myofunctional therapy are teaching you awareness as well as exercises to keep the mouth closed or lip sealed, tongue at the roof of the mouth, nasal breathing, and correct swallow. And a different video, I should have that posted soon, it explains why those things are so important. They seem simple, but it is amazing how impactful it is on your life from birth till you die, just for those 4 things. So again, watch for that video. But if you were to consult or contact me, originally we would schedule a consult or an evaluation or kind of both in one and just discuss what your needs are, history, different red flags that might point that you would be a good candidate for myofunctional therapy. I will say I've gotten a lot of people contact me. I tend to specialize in sleep. That's kind of my passion. Not to say I'm not here to address other issues too, but given my husband's history of like 20 years working in sleep lab and just how impactful that's been on my family, just the whole sleep aspect, that is kind of where I tend to specialize in. So I have had people contact me about a consultation just for sleep, and we can just do a consultation and I can give you helpful information after discussing, habits and looking over your airway and things like that. So I would do a consult for that. That doesn't always lead to myofunctional therapy, but it is an aspect of what I offer at Hope Point Myo. But if we were to go ahead and do the therapy, if we looked things over, you seemed like a good candidate, it was something that you were interested in pursuing, then after the consult, we would schedule an appointment just to start the exercises. That entails, it's approximately 12 weeks. Everybody's different. Some may be doing their exercises incredibly well, and you're making lots of progress. And in that case, we may not need to do the full 12 weeks. Or if it's taking a little longer, let's say you have to take a break because life happens, and and it's maybe the exercises aren't coming as easy. I know for some people, like with the swallowing that I've gotten to with some patients, they're not able to swallow as well, so it's taking a little longer just to train everything to go to function the way it's supposed to. So some might take a little longer, but we say approximately 12, if I said weeks, it's not weeks, it's sessions, 12 sessions, which would be, about 24 weeks. But there's always something generally that comes up with patients, and we need to push it back a week or whatever, just because life happens. And the way that looks, I will say it's kind of like, ideally it's a package deal, and it's kind of like braces. You don't just get braces on and wear them like a month or 2 months and say, okay, I'm ready for them to get off. You have to complete the treatment for it to be successful. And it's the same way with myofunctional therapy. I have had patients who have done it for a period of time and they didn't necessarily complete, but they had and I've heard of this too, but they've had huge benefits and they ended up just stopping the therapy, but you're not getting the full benefit of it necessarily. So you start the exercises, last 12 sessions. We meet every 2 weeks, and I would give you exercises specific for your situation. The meeting takes about 30 to 45 minutes per appointment or per session. I give you the exercises. I make sure you're doing them correctly. We discuss how you're doing, history, things like that. And then you will do those exercises for the next 2 weeks. For me personally, in my practice, I have an app that you could have on your phone. I send the exercises to you. They're on the app. It shows you how to do them. As a timer, you can select when you've done them, and the timer helps you keep up with what you're doing when you're doing it. And that's been very helpful, very positive feedback from the patients on that. But you'll have generally 5 minutes of exercises in the morning that you would do in front of a mirror. Make sure you're doing everything correctly. And then the same 5 exercises in the evening. And then approximately 20 minutes that we call passive exercises, where you don't have to think about it. You could be doing it while you're driving down the road, or kids can be doing it while they're doing homework or watching TV or something like that. So that's a passive exercise. Another thing that I like to incorporate, and most myofunctional therapists do, is nasal breathing or breathing techniques, because especially for people with sleep apnea or sleep related or sleep disordered breathing at night, the breathing techniques and slowing the breathing down and getting that corrected helps even with sleep apnea and things like that. So we incorporate that into the myofunctional therapy as well. So there might be an exercise or two that we work on that with. When you come back the next 2 weeks for our next session, then I give you a new set of exercises. Again, 5 minutes in the morning, 5 minutes in the evening. They don't add on to the exercises you already have, they replace them. And so you would do the next set where it's 5, 5, and maybe 20, somewhere around there, and then still working on some breathing exercises. If you've struggled with one of the exercises, we might repeat that one. And that's where, when it's tailored to you, like you can get online, I believe, and find exercises and things like that, but they're not necessarily tailored to your specific need. And so if you're seeing me for sleep apnea, you would go down one route. In a sense, for the exercises, they all kind of start the same, but go down one route. If you're seeing me for swallowing issues, we would take you down another route and work more exercises specifically to that. So we would continue those exercises until we get close to being done. We go over everything. For some people, if they have a tongue tie, I've had some people with a tongue tie and they feel like they're doing everything well and fine and don't need a release, and that is fine for some. And I've had a patient with this where he wasn't planning on getting a tongue tie release, but as we were doing the exercises, he recognized he was not able to do them well and correctly. And so he got the release done. And it's kind of one of those things when you hit an obstacle, you're trying to do the exercises, you keep hitting this obstacle. So let's say it is a tongue tie, then we get that moved and then you can just keep going. And that's what happened for him. So we would just, any obstacle that gets in the way, we would take care of that. That along that line, part of myofunctional therapy, at least for me, it's not an end all in and of itself if we're trying to solve the mystery of what's causing sleep apnea. It's not just if you're overweight and you have a big neck and things like that. There's so many structural issues that can lead to sleep apnea. And so as a myofunctional therapist, again, with trying to keep the tongue at the roof of the mouth, breathing through the nose, lips closed, some people might not be able to do that because they have an obstruction. It could be a deviated septum, where it's so deviated they have a hard time breathing through their noses during the day or at night. So in that case, I would refer you to an ENT to have an evaluation done to see if that's something that needed to be corrected. It could be allergies or constantly clogging your nose. We would work on hygiene, proper hygiene, to help clear that nose out. If you need to see an allergist, we would do that. For children, a lot of times they have tonsils that are swollen or adenoids that are swollen, and they can do the exercises, but they just can't keep breathing through their noses because they physically have that obstruction and your body won't let you die. So it just keeps opening the mouth to breathe. So as a myofunctional therapist, we are kind of like airway traffic controls, and you can start here, we evaluate, we see what the issues are, and we refer. Same thing even with TMJ issues, we deal a lot with that. It could be that we can get you so far, but you might be in so much pain, all these muscles are so fired up that I need to refer you to a specialist, a dentist, who can give you a temporary splint or orthotic device to decompress these muscles and deprogram them from being tense all the time and relieve some of that pain, so that then you can be ready to keep going with the myofunctional therapy. So it is something where I am not a solo fix all the problems kind of a thing, and never could claim to be. This is a whole body health. And so we collaborate with different providers for these different issues. I also collaborate with like a craniosacral therapist, massage therapist who specializes in fascia or OMM. We have plenty of those in Kirksville. So, or I could find them in your area. Not all my patients are in the same town I'm in. There are several that are throughout the state. So I would find a provider, if I don't know of one in that area, to help you with those issues, to get you past those obstacles and where you need to be. I think that's about it. We keep doing those exercises as things come along. We talk, we work through them, we talk about any benefits you've seen, and again, tailor these specifically towards you. So that's what myofunctional therapy, that's what the therapy looks like, at least from my perspective. and hopefully you'll find help. The goal is, or what it can help with, is a lot of TMJ issues, a lot of sleep, and a lot of this, they go hand in hand. Sleep issues can lead to TMJ because there's a lot of clenching and grinding, destroys your teeth, and I see that every day. So TMJ issues, swallowing issues, headaches, tightness in the neck and shoulders, and sleeping issues, whether it's a newborn all the way up to 99, 100, sleeping issues, airway issues, and sometimes you have sleeping issues and you don't even know it. You have all the symptoms. So if you have any questions, feel free to comment or ask the question. I'll be glad to answer. Or you can schedule a consult or talk to me about scheduling a consult to see if you feel like myofunctional therapy or wondering if it would help you in your situation. We can always talk about it. I'm not about, yeah, let's do it. It's a thing of, let's just even see if this might help. And we can never guarantee anything in myofunctional therapy. Just in health, you can't guarantee anything. But it's one of those things, if it seems like you tick all the boxes and that's what myofunctional therapy is about, it absolutely could potentially help. So feel free to comment. Bye.